A British poster from World War II describing the cost of the common cold. While the cause of the common cold was identified in the 1950s, the disease appears to have been with humanity since its early history. Its symptoms and treatment are described in the Egyptian Ebers Papyrus, the oldest existing medical text, written before the 16th century. The name, cold, came into use in the 16th century, due to the similarity between its symptoms and those of exposure to cold weather. In the United Kingdom, the Common Cold Unit was set up by the Medical Research Council in 1946, and it was where the rhinovirus was discovered in 1956. In the 1970s, they demonstrated that treatment with interferon during the incubation phase of rhinovirus infection protects somewhat against the disease, but no practical treatment could be developed. The unit was closed in 1989, 2 years after it completed research of zinc gluconate lozenges in the prevention and treatment of rhinovirus colds, the only successful treatment in the history of the unit. The common cold is a viral infectious disease of the upper respiratory tract that primarily affects the respiratory mucosa of the nose, throat, sinuses, and larynx. Signs and symptoms may appear less than 2 days after exposure to the virus. These may include coughing, sore throat, runny nose, sneezing, headache, and fever. People usually recover in 7 to 10 days, but some symptoms may last up to 3 weeks. Occasionally, those with other health problems may develop pneumonia. However, there is no vaccine for the common cold. The primary methods of prevention are hand washing, not touching the eyes, nose or mouth with unwashed hands, and staying away from sick people. Okay, so let's look at the symptoms now. The typical symptoms of a cold include cough, runny nose, sneezing, nasal congestion, and a sore throat, sometimes accompanied by muscle ache, fatigue, headache, and loss of appetite. A sore throat is present in about 40% of cases, a cough in about 50%, and muscle ache likewise in about 50%. In adults, a fever is generally not present, but it is common in infants and young children. The cough is usually mild compared to that accompanying influenza, while a cough and a fever indicate a higher likelihood of influenza in adults. A great deal of similarity exists between these two conditions. A number of the viruses that cause the common cold may also result in asymptomatic infections. We will look at this further. A cold usually begins with fatigue, a feeling of being chilled, sneezing, and a headache, followed in a couple of days by a runny nose and cough. Symptoms may begin within 16 hours of exposure and typically peak 2 to 4 days after onset. They usually resolve in 7 to 10 days, but some can last for up to 3 weeks. The average duration of cough is 18 days, and in some cases people develop a post-viral cough which can linger after the infection is gone. In children, the cough lasts for more than 10 days in 35–40% of cases, and continues for more than 25 days in 10%. Okay, let's see how this is transmitted. The common cold virus is typically transmitted via airborne droplets, aerosols, direct contact with infected nasal secretions, or fomites, contaminated objects. The viruses may survive for prolonged periods in the environment and can be picked up by people's hands and subsequently carried to their eyes or nose where infection occurs. Transmission from animals is considered highly unlikely. Transmission is common in daycare and at school due to the proximity of many children with little immunity and frequently poor hygiene. These infections are then brought home to other members of the family. Okay, so finally let's see how to prevent this. The only useful ways to reduce the spread of cold viruses are physical measures such as using correct hand washing technique and face masks. In the healthcare environment, gowns and disposable gloves are also used. There is no vaccine to protect against the common cold. Vaccination has proven difficult as there are many viruses involved, and they mutate rapidly. Creation of a broadly effective vaccine is, therefore, highly improbable. Regular hand washing appears to be effective in reducing the transmission of cold viruses, especially among children. Wearing face masks when around people who are infected may be beneficial. It is unclear if zinc supplements affect the likelihood of contracting a cold, but routine vitamin C supplements do not reduce the risk or severity of the common cold, though they may reduce its duration.